My name is Este Geraghty and I serve as the Chief Medical Officer at Esri. And Esri is a technology company. We build the world's most powerful mapping and spatial analytics software. We've been around for 53 years and we are a global company, and we serve organizations from local governments to ministries of health to commercial organizations and whoever needs to take advantage of location data. So a lot of times people ask, what is a GIS? Well, technically it stands for Geographic Information System. And the fact of the matter is, it's like any information system you're already familiar with. It is composed of hardware, software, and tons of raw data to help you make better decisions. But there's something specific about a geographic information system, and that is that it focuses on a fundamental principle of geography, and that is location matters in people's lives. So we put all of that together to develop understanding that precedes informed actions. GIS is used for just about every industry you can think of, and a lot of people can understand that, and they say, but yeah, how is it used for health? Well, GIS is used for health in a number of ways. You can think about the location of services. Are they accessible by the population that you intend to use those services? So thinking about access to care and access to public health programs, for example. You can also think about location as a way to understand populations. So do we have positive or negative population health outcomes? Are there patterns in the outcomes, maybe disparities or gaps in different services or the way that people are responding, so that you can understand those patterns and then start to use geographically targeted interventions to really mitigate or solve the problem. So geography matters in everything that we do. It's the context around us. And in health, we use that to develop better understanding of people and populations to make sure that services are accessible and to perform interventions that make sense for the right people at the right time and in the right places. Topic that we have been working on for decades, and longer than that actually. I could point to the history in the 1800s of when this all started, is equity. And I think a lot of the work in equity in health has been very much analytical and understanding where we have inequities, where we have disparities. I think part of the reason for that is that we're a population, a group of people who are really focused on understanding and analytics, but now it's time for applying that information to communities around the world. So how does GIS help with equity? Well, first of all, we can help with that analytic piece because parts are moving all the time. I mean, in the last 2 years, we've seen populations completely change. The demographics of an area are different than they were 2 years ago. So we can understand those shifts in demographics, which populations may be affected, and again, go back to understanding what are the patterns in the relationships that may be causing structural inequities and resulting in health disparities. So understanding is first. Geography can help us do that at a very local level. And then the other part of what we can do in equity is engage communities to start to understand and build the story around those gaps that we see by incorporating the lived experience. What do people who live in that area really experience? What are the true problems that they're facing? And how do we bring that into a context that then informs the next step, which is applying our resources to the populations that are most in need in the right places? So geography really takes you through the whole workflow. It just gives you a really targeted way to understand and act. The last 2 years have been pretty busy in the world of geographic information systems, and many of you probably can imagine it just by thinking about, obviously location is important when you're talking about the spread of disease, and this has been obviously a global concern, a global disaster, a global tragedy, and GIS was there from the beginning. Many of you may remember it was back in January of 2020 that Johns Hopkins University first put out a dashboard showing deaths from this novel coronavirus originating in the Hubei province of China. And that dashboard was built with GIS software. And what Johns Hopkins did that was so amazing was they made all of the data for the cases and now vaccinations and everything related to their dashboard open data. And so thousands of organizations said, oh, we need to get our own local real-time situational awareness. So GIS supported that situational awareness, and you saw sort of copycat dashboards, but I mean that in the nicest way, of people customizing it for their own use. But then it went beyond that. We started using GIS to understand how people were actually behaving with social distancing. We could use anonymized and aggregated cell phone data to watch the movement of people and were they really adhering to local policies and guidelines. Then we could use that same social distancing data to inform models, some of the compartmental models that are used in epidemiology to understand impact on hospital capacity, on regular hospital beds, ICU beds, and ventilators. So by taking those spatially varying parameters, like social distancing is different in different places, like the disease spread is different in different places, we could pinpoint exactly which hospitals were likely to be the most impacted, how long that was going to last, and how impacted they would actually be. Then that led to decisions about where do we need to expand capacity, where should we take a dormitory or a convention center and start to turn that into an alternate medical care facility for the overflow. So that's geographic site selection is a very common use case. And then we get to vaccines becoming available. And geography has been and continues to be worldwide really important in figuring out how do we make sure that we put vaccine locations in the right places to serve the populations with an emphasis again on equity. How do we place them where people can have access? If they need walk time access because there's low vehicle ownership in an area, if they need access based on language capabilities, people who can actually tell them in their language how the vaccine process works. All of those things can be done with geographic information. So end to end, even now to wastewater surveillance, GIS helps us to understand how that process is happening and view on a map where the variants are coming from and where they're existent in a community. So I would say location was central to pandemic response. Nowadays, everybody is wanting to talk about machine learning and artificial intelligence, and so people who know about GIS naturally wonder, well, what does the GIS play in that space? Well, I would say that the work that we do is really based in three logical areas. GIS is great at understanding clusters of information. And in the machine learning AI world, we're looking at spatial clusters, and then you might think on a vertical axis, temporal clusters. So over time, can we start to look at where things are intensifying or where they're receding, and how does that compare to a policy intervention or a medical intervention? So we can look at clustering methodologies to gain a better understanding of what's going on and what's coming. But what's coming is the next section, and that is prediction. So GIS really helps us to combine multiple layers of information, take this complex world around us, and stack all these layers to predict the unknown. So in most recent times, we've been able to, for example, predict death from COVID-19 in various jurisdictions and understand some of the contributors with some time lag importance parameters. Like, I can tell you that if there was a holiday 13 days ago, the death rate is going to be high on that day. If there was an increase in hospitalizations 9 to 14 days ago, death rate is going to be increased. So we can look at these things and make predictions really relevant to space and time. And then the third category is image classification. And this is actually very useful even beyond health, but you can look at images, anything that you can see with your eyes, a machine can learn to classify and identify. So we've done this, for example, with building footprints, so that you can identify where people exist in buildings, right? If there are countries that don't have a population census. So if you can identify the buildings, you can identify where populations might be. This is important for things like polio vaccination programs that the World Health Organization organizes. But you can also identify green pools and figure out where there may be stagnant water and potential for vector-borne disease. Or you can use drones with heat sensors to figure out where there may be homeless encampments that you weren't aware of by their heat signatures, and then be able to intervene and offer support services. So lots of room for creativity with machine learning and artificial intelligence with a location basis. Using my crystal ball and looking toward the future of health tech in the next 5 years, I think I'm optimistic. I think it's going to be amazing. What I really think is that all of the funding that's coming in, all of the lessons that we've learned from COVID-19 have shown us a number of things that are really important. One, that we need to be better at sharing data. And so I think we're going to see more of that, because the recognition has been profound that has not been happening enough. I think we're going to see better data interoperability, and I think those go hand in hand, right? Data sharing, and now you want the data to make sense in your own system, in your own platform and efforts. And the other thing that I may be slightly less optimistic but super hopeful for is that we start looking at the world as a single ecosystem. We have for too long been siloed into our very confined, very focused and important areas of analysis and research, but we need to look at the world as a system. Everything is interconnected. I mean, obviously, a public health crisis shut down the entire world. So we have to make room for analysis that is interconnected, that can account for layers and systems of information. And I think we're going to see more of that collaboration. I think it's a little bit longer pathway. Maybe we'll make some good progress in the next 5 years. And then, of course, my hope for the last thing that I think is that the incorporation of location information is going to become natural. I won't have to talk about it as a new thing anymore. I'll talk about it as, of course, we consider the location of where people are and what that means in their lives. So that's what I think.